good job showing up to the gym and getting in a good workout, but is it the right workout for you? What if we're doing it all wrong? Dr. Sean Riley from Tulsa Spine and Rehab is here to talk about the importance of training movement, not muscle. What do you mean by that, Dr. Riley?
Hi, Scott. Yeah, so there's a term that comes up in clinic, a lot: functional rehab, functional movement, functional screening. All that means, function is how we're moving or what you have the capacity to do. I mean, can you sit to stand? Can you flex it through your hips? Can you extend? Can you rotate? All these simple movement patterns throughout the day, just are related to function and how that can contribute to injury and so forth down the road. So the model that we've developed here at Tulsa Spine and Rehab is that training movement and not muscle. So a lot of years ago, you would go to the gym and, you'd work out with a trainer, and he would say, okay, we're going to get your biceps built bigger. We're going to work on your pecs, these types of things. We're going to increase some girth or some, the capacity in those muscles, which, I don't agree with, because I think that you're essentially you could set yourself up for injury on down the road. When I say that I want to train movement, I want to figure out where someone has limitations in mobility, whether it's in their motor pattern. And what I mean by the motor pattern is, the way their brain perceives the movement. So, Scott, if I were to ask you simply to put your feet together and try to bend over and touch your toes, I'm looking to see how well you move and where you may have some limitations, okay? And from there, okay, I might take you to some breakouts or progressions or whatever you want to call them to determine where your true limitation is. Because 9 times out of 10, Scott, if I ask you to bend down and touch your toes and you're unable to do that, you're likely going to tell me your what is tight.
Probably your back is tight.
Right. Yeah, your back, your hamstrings, and a lot of times that's not the case. It might be of just a function. Your brain doesn't know how to move properly. You've lost the motor pattern. You need to be retaught. So from there, it could be a motor pattern issue. Secondly, there could be a tissue issue, meaning that you truly have tightness in a muscle somewhere. And from there, we appropriately can make a recommendation for a treatment, whether it's some type of clinical massage or active release or myofascial work, some manual therapy to loosen up the tissue. And then lastly, there could be a joint issue where you have a restriction within a joint, which would be a good candidate for maybe some type of manipulation, some type of mobilization. So it could be a motor issue, okay, with the way your brain perceives the movement. Secondly, it could be an elastic issue within the tissue. And lastly, a joint mobility issue. And so what we're trying to do before we work on any type of training or fitness or rehab, we want to reestablish and reinforce proper motion, okay? So in the clinic here, when we're rehabbing patients, or we might be doing general fitness, or I'm doing a discussion or a talk, and I'm talking to folks about this, before we proceed on to adding load or weight or any type of resistance, we're going to make sure you can move properly and you've mastered that motion. With, in the instance, let's say, Scott, you're unable to bend down and touch your toes, we're going to do things that we're going to get you on the ground, and, you're not going to have weight or anything. We're going to start to reestablish and reset your brain on how to move properly in flexion. And then from there, we might get you into a kneeling position or a quadruped position. And then ultimately, you're going to be standing up, because that's the way we live our lives, hopefully on our feet. And then from there, we can add load and weight and resistance and all those types of things. But before we will even consider, adding load and resistance and those types of things, you'll need to pass a series of progressions or so forth to let us know that you have the proper motion, okay? And your norm might be different than my norm and someone else's norm, but we want to maximize your motion. And what we're doing there is we're hopefully going to prevent injury, and we're able to train you safely and teach you things to do on your own in a safe environment without creating injury. Because that's what a lot of times we're all about in here is, patients come in and they have a problem. We want to make a determination of what their problem is or what their diagnosis is and the best course or treatment to help them. And then from there, we want to, give them safe recommendations on how they can manage their conditions on their own.
So what I hear you saying is, let's say I want to have more muscle tone in my arms and shoulders and that sort of thing. That's an okay goal, but I don't just go in and start doing all these upper body workouts. There's a process before that if I want to do it properly.
Absolutely. So let's say you were wanting to focus on upper body, and then, two things that I'm going to really focus on, areas for injury that I would be concerned that you could possibly create as an injury in your shoulder or even in your neck. So I want to make sure that you've got good mobility within your shoulders, okay? External, internal rotation, flexion, extension, all this to abduction, adduction, all those types of things to make sure you have the motion. Because typically what happens if you lack motion or proper mobility, you're going to create a compensation, and then the compensation is going to lead to injury. So what happens is we develop these muscular imbalances. That's what leads to the compensation and ultimately could lead to some type of injury. Thoracic spine is another area that I'd want to check for mobility with you. It's obviously just fine to work on upper body strength, but we want to make sure we have enough mobility in some certain areas around that as well.
Whether you need rehab or if you're going to put in the time and effort into a fitness routine, you need to make sure it's right for you. Dr. Riley and his team at Tulsa Spine and Rehab can help. All you got to do is give them a call, 918-743-3737.